At Bupa, we understand that mealtimes can sometimes be a stressful experience, especially for children. We're here to help and to provide guidance on any eating difficulties. When supporting someone with eating difficulties, it is important to know that it is not necessarily always focused around calorie intake and body image. An eating difficulty is when a person struggles with eating, which could be for a variety of different reasons. This could be linked to sensory difficulties, for example, the taste, texture, or even smell. Another type of difficulty could have stemmed from having had a distressing experience with food, such as choking or vomiting, or experiencing a significant abdominal pain. This can be perpetuated within children, causing the young person to develop feelings of fear and anxiety around food or eating, and lead them to avoiding certain foods or textures. We understand that mealtimes can be difficult for both the person who is eating the meal and those supporting them. Some of the following supportive strategies can be used to help make things a little more manageable during these times. Planning is key. Structure and consistency are extremely important for children with eating difficulties. Planning mealtimes will help ensure that any last-minute changes to meals or mealtimes are avoided, as this can aid in reducing any unnecessary anxiety around eating. Establish mutual expectations, clarifying what is expected of the person eating and the support that is required, and how this will be prompted should it be needed. Conversations don't always have to be about eating during mealtimes, as mealtimes can be difficult enough for the young person. Introduce open conversations around what would be helpful for your loved one who is struggling eating. This could be done in a support plan style. Discuss the following. How do they want to be supported during mealtimes? What things will help them and what will they not find helpful? What distractions can be used during mealtimes? Try playing cards, word searches, listening to music or podcasts. Being open and honest in things that you have observed can be a great way to support a young person with eating difficulties. Try not to be critical. Look for things from the young person's point of view. It's understandable and okay for you to feel frustrated, as difficulties around eating may put a strain on the family, regardless of how close a family is. For a young person eating, this could have become their biggest fear. It is important to seek help and guidance from your GP as a first point of contact with any concerns that you may have with your child in relation to any eating difficulties. This is to ensure that you can access the correct help and support.